Hi, I'm Martina. Welcome to my channel Ich werde gesund. Today I have the opportunity to interview Dr. Rebecca Kennedy from the United States. Dr. Kennedy is a family medicine physician, but from my point of view, she's also a great mind-body expert. And amongst other things, she focuses on syndromes like Long Covid and ME/CFS. And today we will talk about Long Covid and ME/CFS. But before we start, as usual, I don't want to convince you from anything here, nor do I want to discourage you. Also, I know that each way into such a syndrome is something very individual and each way out. And all the things we discussed today don't replace talking to your doctor or therapist. And there will also be a written summary with some key points about this interview on my website in German and English. Hi, Dr. Kennedy. Hi, Rebecca. It is really very nice to have you here on my channel. Welcome.
Oh, thank you. It's great to be here.
Yeah, that's really awesome. Thank you. Yeah, first, maybe I would like to know a bit more about you. So if it's okay for you, could you please tell me a bit about your work as a physician and also why there is this interest on mind-body medicine and conditions like long COVID and chronic fatigue syndrome, also chronic pain conditions and things like IBS. That would be great to
Yeah,
know. So maybe it's from your work as a physician, maybe it's also from personal experience. So that would be great to know.
yeah, absolutely. So I'm a family medicine physician. I've been a physician for over 20 years, and I live in Portland, Oregon. And over the years of being a family medicine physician, I saw many, many problems that our medical paradigm just can't help very well. And so I just became very curious over the years of working as a primary care physician of what we were missing. And probably 40% of the patients that come into primary care is because of some sort of neuroplastic condition, mind body condition, and we're just really not able to help very well. And there's often a pattern that I was seeing, and many doctors know and see, of that list that you described of a lot of chronic pain syndromes, fatigue, irritable bowel syndrome, but often it's also related with some mental health issues, anxiety, depression, but those aren't necessarily the reason for it. It's not always there, but often bigger stressors, a history of trauma, high ACE scores are also often connected. So seeing this pattern year after year after year, but sending people to all of the specialists, to mental health, therapy, psychiatry, often didn't help. And as a family medicine physician, patients come back to us when other things don't help and they try all of these different things, alternative practitioners, we're the ones that they come back to. And we also see the whole person. We talk with them about all the different organ systems that are going on, as well as their mental health, as well as what's going on with them in their life and their childhood. So really seeing the whole person and seeing this pattern over and over and over, it it just became this intense curiosity for me, actually, about what are we missing. And it's really our job as the physicians to figure that out. And it really saddened me that patients are coming to the physicians, we're not helping them, and then a lot of times we're making them feel bad because we can't figure out the problem, and it's frustrating for everybody. And so I just looked and looked and looked, and for years searched. Um, I read things, did continuing medical educations, went to webinars, and I just was always searching for years and years. And, got a little bit close with kind of the nervous system and stress response and what's happening with our sympathetic nervous system. But still, the answers weren't quite there. It was like mindfulness based stress response or cognitive behavioral therapy, but it just really wasn't enough. And so I just kept searching and searching. And then fortunately, a good friend of mine from medical school told me about Howard Schubiner because I went to medical school in Michigan, and then also being in Portland, heard about Dave Clark, and so found this mind body model and was super excited about it, and just spent every moment that I possibly could learning about it, and then working with my patients with it.
Wow, that sounds absolutely amazing. That's so great. I would wish that every doctor would be like you, searching and wanting to understand. And yeah, that's really amazing. What is
Yeah.
really also very interesting, but also a bit awful, I must say, is that 40% of the patients have these conditions where, yeah, where a physician can't help and people have to go from physician to physician. And yeah,
Yeah, and with that, I mean, it's not necessarily that 40% is, someone with debilitating, CFS, but migraines, IBS, a lot of, chronic back pain and anxiety, depression, lots and lots of pelvic pain, lots and lots of disorders. And it's interesting, Martina, is yes, it is kind of, sad that we don't have this in our medical paradigm more than it is and more people know about it. But I think the important part is really that this is about being a human being and this is how we are designed. And really, everybody has had some sort of mind body condition at some point. It's just the normal thing that happens with our physiology and our brain, and that's it. Not everybody certainly has had chronic symptoms that's been very overwhelming, but having a slight headache because of a stressful day, or maybe a little belly pain because of some stress people are going through, or whatever it is that really everyone experiences this because it's just the normal psychology and normal physiology. And once we can understand that, it can really be transformative.
yeah, I totally agree with that. That's exactly that's exactly right. Yeah, so thank you very much for this explanation. Before we go into a bit more detail about what these conditions actually are, from your point of view, I would like to talk a bit about certain terms that are used for these conditions. So, for example, when people like you or Howard Schubiner or other mind-body specialists, and even I now talk about conditions like ME, CFS, or Long Covid, people use terms like mind-body syndrome or sometimes psychophysiologic disorders. Also, some physicians talk about functional disorders. And of course, very often the term psychosomatic is used. So when I look back at my own journey, I was really confronted quite often with this term psychosomatic. And because it was usually used by a doctor when I saw the doctor and when he did some tests, and yeah, the tests were normal or were okay, or there was something a bit, but it couldn't explain my symptoms. Then he gave me the answer, you're physically well, you're okay, there's nothing wrong with you, so it must be in your head. And there they meant it's your psyche, it's your mind, so there's something wrong with your mind and with your psyche. So over time, I got really defensive
Yeah.
about this term psychosomatic and all these mind-body medicine things. And during my own recovery journey, I dove into that topic quite deep, and now I have a totally different understanding. And I'm very open to that, and I use these terms myself as well. But it would be great to hear from you, just a short explanation, maybe what you understand under these terms, and maybe also that yes, there is something in your head, but maybe not as you think. So if you like, you can just talk a bit about these terms, and if you like, you can also just dive into what this actually is from your point of view.
Yeah, all of that is such a great place to start because how we're thinking about it in the terminology is critical. And very few people use psychosomatic these days, kind of in this world. And, it just has so much stigma, and the idea kind of back in the day when people talked about it was really just like you're saying, like, oh, well, it's kind of made up. It's all in your head. It's not really real, which is really absolutely far from the truth. So, it's really understanding that our brain, 95% of our brain is the unconscious automatic part of our brain, 95%, which is astonishing. And I didn't even really know that until I learned about this model, but only 5% of our brain is our conscious awareness. And so this whole 95% of our brain controls our body. It tells every single part of our body what to do through a biochemical communication system away from our conscious awareness. And all it cares about really is survival and danger. And it spends our whole life storing and remembering information that we've gone through in order to respond to danger. And this is happening in our primitive brain, in our unconscious, automatic, reflexive neural pathway communication. And it's happening through biochemical changes. So this huge cascade of hormones and cortisol and adrenaline and all of these different hormones and cells that are created, inflammatory cells, and all of these things are physiologic changes that are happening in our body, but it's because the danger system is turned on, it's activated, our unconscious brain is perceiving danger and responding as if we're in a physical threat of danger, like the saber-toothed tiger jumping on us, because that is how our brain evolved. So it's understanding that because of our psychology and just the normal functioning of our brain is interpreting that we are in danger because of, again, our psychology, our thoughts, worries, emotions. We only have one danger detection system, and that turns up and dials up the danger part of our brain and our unconscious brain, which then automatically sends this cascade of biochemical changes in our body, just like if we're embarrassed or and we blush, those are biochemical changes. You can see the redness. We can have swelling. We can have rashes. Our heart is beating fast. Like all of these things are happening biochemically in our body, but the underlying source is our psychology. So it's where the two blend together. In terms of the um, language that we use, I do think it's so important because it can be such a sometimes a fine line of how people understand this, and it is 100% not about that you're making this up, it's not really real, it's all of these things. It's just really understanding it for what it is that the source of it is the signaling from the brain rather than damage in the body, and this is the normal functioning of our brain and our body. And that's it. And if we understand that, and the new neuroscience that understands it better, then, I mean, the beautiful part is then we can get better. People can get better. So the terms that I like to use actually is a neuroplastic condition, um, even rather than mind body. I think mind body is absolutely accurate, but I think sometimes it can be perceived as not scientific necessarily. And there's a lot of a new field that's really expanding and growing about the idea of neuroplasticity, and that it's the idea that our neural circuits and our neural pathways through a nervous system can change over time. And And so I like to think about it in that way. Again, just understanding that this is a physiologic process that we don't have direct conscious control over that's going on, and understanding that is how we can then make changes and restore health.
Wow, yeah, that's an absolutely fantastic explanation. That's really great, and that is so important to understand because, as you say, it's simply it is actually something normal how we react in many situations, and that we shouldn't make a difference between what's up here and what's down here. So because everything is connected, and there's always an interaction between the body and the brain, and between the brain and the body. And of course, it has effects on your psyche, on your mind, so how you think and how you feel. Because yeah, when you feel stressed and tense, then maybe you have more anxious thoughts, or the other way around, when you remember something, or yeah, or you have to go to a doctor's appointment and you feel anxious, then suddenly your physiology changes. So this
Yeah,
is really
yeah,
very
yeah.
important to
And I
understand, I
want to
think.
say actually a quick point on that is absolutely everything you're saying happens. But the other thing also is that this is also, it is about the unconscious brain's automatic response. So often we're not necessarily feeling stressed or worried or anxious in our conscious awareness, but it's just the neural pathways of what the unconscious brain is automatically responding to. And so understanding that side of it is important also.
Yeah, exactly. You used the term neuroplastic condition or neural pathways. I don't know if everyone is really so familiar with that. I know that many people are diving into neuroplasticity now, but maybe you can just explain in a few words what this is, so as simple as
Yeah.
possible.
Yeah, no, totally. Yeah, it's the idea that the signals between our brain, the part of the brain that controls our body, the unconscious brain, and our body, that signaling happens through our nervous system, our neural pathways. And so, and the idea of the plastic part just means it can change. So the neural pathways can get created and change throughout our life. And as a baby, you come out and you don't have these neural pathways created yet. And through living your life and experience is how you start creating those neural pathways. So, how you learn to walk and move your hands and grab things, and really everything that happens is by creating the neural pathways. So, changing the neural pathways. It used to be thought that once those neural pathways were changed as a child, that they got to the point where you couldn't change them anymore. But kind of the new information is that actually they continue changing throughout our life. And just like learning a skill, learning to type or learning to dribble a basketball or whatever it is, or to drive, that is all neural pathways that are created through practice. And so with typing, it's that you, with your conscious awareness, you're moving your fingers and you're practicing and practicing and practicing. But as you continue practice, you're changing those neural pathways so that it's between your unconscious brain and your body automatically. So then you just type without thinking about it consciously. It's that neural pathway. And so if you take the keyboard away and you put a new keyboard down and the P is on the left instead of the right, now you have to create a new neural pathway. And your right fingers just automatically keep going to the right side over and over and over. But with practice, we consciously put our left finger over to the left side with our new keyboard. And once we practice that over and over and over, that's that neuroplasticity. We're changing the neural pathway and we keep practicing until it then becomes just an automatic, unconscious habit that we don't have to think about consciously anymore. And so that's sort of the idea, is that the symptoms happening in our body are happening because of the signals of our neural pathways. They have been created and then they're stuck in place like an automatic habit. And now we need to break that cycle, break that pathway, and create new neural pathways to turn off that signaling and create something new.
That is really interesting. Yeah, this is such an interesting and amazing field in science, I think. And yeah, I'm curious what will happen over the next years with this neuroscience approach. That's really great.
Yeah.
Um, so you actually say that things like ECFS and long COVID might be something which is created by the brain, such as which comes from the brain, and that there are neural pathways in your brain that have an impact on your nervous system and how your nervous system responds, and that there might be a change in these which neural pathways are used because in these conditions we know that they are stress related, and maybe people have a history of chronic stress, sometimes also a history of trauma, and sometimes of, as you mentioned, ACEs, that's adverse childhood experiences. So could you explain the connection between chronic stress and this danger signal in the brain, and why this plays an important role, or from my point of view and from your point of view, plays an important role in becoming these syndromes?
Yeah, yeah. Yeah, the way that I talk to my patients about it is that, the current medical model understands that when there are symptoms in the body, they're generated because of some sort of damage in the body. And many times that is the case. I mean, that happens if you have a strained muscle or a broken arm or a tumor or an infection or a damage to the major nerves. All of that is going to generate the symptoms because the brain is responding to that signal that's coming in from the body. So all pain is made as a warning signal from the unconscious brain. That's some of the new neuroscience that we now understand about how pain is made, which is an important concept to understand. That pain is not generated by the nerves out in our body. The nerves take the information of the damage in the body, send it to the unconscious brain. The unconscious brain then interprets it and decides, does this mean danger or is it safe? When it interprets that it means danger, that there's damage in the body, it then sends the warning signal of pain or whatever else the signal is back down in order to communicate with the conscious brain that something needs our attention, because our conscious brain is what determines our behavior. We decide not to move our hand if it's broken so it can heal and we don't die. So all pain is made as a warning signal from our brain, and our brain can get it wrong. Our brain has a bias towards danger. It behooves us to err on the side of caution. And so the brain creates more warning signals than maybe we actually need. And so that if I break my hand, if that danger detection system is dialed up and I have more of a hypervigilant brain because of these stressors and dangers that I've been through, then it's more likely that that warning signal of the pain might actually stay in place after my body actually heals. And so again, switching from thinking about damage in our body as the generator for the symptoms to now let's go up and stand at our brain, our primitive brain that only cares about survival. That's where the danger detection system is located. Stand at our primitive brain and look down and view it from that perspective. And the more danger that our brain has been through throughout our life, the more that it stores and remembers that, dials up our vigilance, and then is more likely to be interpreting the millions of pieces of information that's coming in at all moments. It's more likely to interpret that information as danger rather than safe. So if you think about if we have a bathtub and we fill it with water, and that's the stresses and the dangers that we've been through, if it still is contained in the bathtub, then our nervous system can actually still sort of remain in the calm state. But as we continue to fill that bathtub of dangers and stressors, then it can get to the point of spilling over. And when it's spilled over is when our nervous system is over in that fight, flight, or freeze. The hypervigilance is dialed up. I think of it as a dimmer switch on a light of our danger system. It's dialed up. And again, the information coming in then gets filtered through this hypervigilant brain that then is more likely to respond as if we're in danger. So when the brain is then responding that it's perceiving danger, then it's sending all these warning signals to the body. And the brain tells every single part of the body what to do. It tells our heart how to beat. It tells our digestion how to digest. When we're running from a saber-toothed tiger, we shouldn't be spending our energy on digesting lunch. And so our digestion is shut down. Our immune system is shut down. Our hair can fall out because we don't care about creating hair when we need to be surviving. Every single part of our body, our hormonal system, the little muscles on the insides of our blood vessels open up or close down. I mean, literally every single part of our body. So that's why there can be 200 different symptoms with long COVID, for instance, but yet the testing is normal in the body. Because again, if we think about it, it's about the brain automatically responding to this information coming in reflexively as if we're in danger, and then that gets stuck in a loop. It actually then can even become the symptom, information coming up to the brain, and then the brain responding to that symptom through more danger, and then sending down the danger signal. And then it's that neural pathway is then just stuck in this loop. And fatigue can also be one of those danger signals that when we're infected with a virus or bacteria, fatigue can be a danger signal to let our brain know, get in bed, stop cleaning the house and going to work, so that our body's energy systems can go towards fighting this invader again so we don't die. But much like pain, fatigue can be stuck in place when we don't have an infection and we don't need that danger signal. There's also certainly a lot of biochemical changes with our ATP and mitochondria, all these different biochemical changes with that as well. But really, the root of it is getting into that perceived danger in our psychology and our unconscious brain.
Wow, that's really a great explanation. That's also a lot of information, and my mind is running at 180 kilometers per hour now because it makes so much sense. But it's it is really new, and it's maybe something people have to digest. But it is really a great explanation that when people like me went to so many doctors with so many different symptoms. I mean, I had many syndromes and many symptoms, but when there's actually not something wrong or you're not broken, there's no tissue or organ damage, then it's really interesting to know what's happening there and what's going on, and that it is something which is created by your brain, because your brain is so sensitized and so hypervigilant to all the stressors and traumas and things you have experienced in your life, and that perceives simply everything as dangerous, and even your maybe normal body sensations where you normally would say, okay, maybe my gut is a bit a bit uncomfortable, but that should be okay. But when your brain is so hypervigilant, then you say, oh my gosh, there's something wrong with my gut and I have to go to a doctor, and maybe I have a kind of dangerous reason for that. So that's really
Mhm.
something very interesting, something very important, that your brain can be the cause of these symptoms and syndromes, and that this is the explanation. Also, what you said, that this can that there's a whole cascade which is activated, and that this can be an explanation for this so many different symptoms, and they really can feel terrible. I know that from myself, but yeah, that's just a physiological response to a hypersensitive brain.
Yeah,
Yeah.
right. Yeah, and a couple thoughts about that is right, a higher ACE score or trauma, capital T or little t trauma that we've been through or stressors, all adds to this. And there's also even, sort of protective mechanisms that our normal psychology develops because of the things that we've been through, and they can be personality traits like being a perfectionist and being a high achiever, having being hard on ourselves, needing control, being a people pleaser, which I raise my hand to all of, and those personality traits can often also be a part of this, or very frequently are part of this. Is that those personality traits came about to get us through whatever we went through in our life, and they can be helpful in lots and lots of ways, but our unconscious primitive survival brain tends to take them to the extreme. And when it does that, it then dials up the danger part of our brain. So a lot of it also can be these personality traits. And I have many patients that, try to maybe understand that the nervous system is involved. So maybe then try to maybe stop working. And so they can attend to themselves and kind of do all of these nervous system calming things, and then their symptoms are worsening. And part of that can actually be that the personality trait of needing to be high achieving and a perfectionist, and that is what brings the primitive brain safety because of, again, what they've gone through in life. So then the brain says, whoa, well, this isn't safe. And so then they can worsen even because of that. And if we don't understand that and really put, what we need to do in place because of that, then again, the symptoms can actually just steamroll and worsen. So again, it's really understanding how our primitive brain works, and that from the perspective of our survival primitive brain, because it is not what our rational brain would think. And it doesn't necessarily make sense from our rational thinking. But again, we really have to understand it from the primitive brain's thinking.
Yeah, that's very important, and also what you say, that also things like personality traits. So I'm also this person. I say to everything, yes, I'm a people pleaser. I'm a high achiever. I'm put a lot of pressure on myself. I know I learned a lot about these things, and I'm changing this, but it's not so easy to
No,
change
it's not easy.
habits that you
No.
had for 40 years or so.
Yeah,
But
yeah, right.
um,
Hmm.
the first really important step is to understand that these things
Yeah,
can also play a role why you maybe became ill, why you maybe still struggling with this, and also when you're on your recovery journey, that sometimes you get to a point where you feel much better, and then you bounce back into your old habits, and suddenly you feel that you're not fully recovered, and then you have to ask these questions: what are the missing pieces? And then it often comes to, I see it on my own and from other people as well, that now we have to look at the whole person and at the story and at the history and at things
yeah.
like personality
Hmm.
traits. And also very interesting, um, when we talk about personality traits, is also emotions. So I would like to talk a bit about this with you, if that's okay. So
Absolutely.
I have learned from my own journey that emotions, and especially suppressed emotions, can play a huge role in why you became ill with such syndromes. And also, maybe it's also an important thing to know and to work with when you want to recover. And I think that emotions can play a role in these illnesses is often overseen. But I have a great example from for two weeks ago, and I just want to share it. So one morning I woke up, and then suddenly I felt a really severe and strong pain in my belly, and it was here in my lower right, and it was
Hmm.
really a stabbing pain. It was so intense I couldn't even breathe, and I thought, oh my gosh, this must be my appendix. So there's really something wrong. And then
Yeah.
because this pain was so strong, I started to cry. And after that, I really started to cry. I mean, there were a lot of tears, and suddenly I thought of a special person, a very important person. And this person, I lost this person 3 years ago, and suddenly I had to scream his name. And I was really full of tears. And this was maybe 30 seconds or 1 minute. And after that, suddenly there was no need to cry again. I felt much better. And suddenly this pain was gone. It wasn't my appendix, but it was something with grief and maybe
Yeah.
suppressing
Yeah.
grief for a while, maybe for a few days. And I was looking at the situations, and this was so fascinating that there wasn't something wrong with my gut or with my appendix, but it was just
Yeah.
emotions.
Right.
In,
Yeah.
in quotes, just emotions. So, um, yeah, what's what's it with this emotions? Why can emotions have such an impact on the symptoms and the
Hmm.
syndromes? And yeah, that would be really interesting to know.
Gosh, Martina, that's a amazing story. I mean, you know, really important points about that. So a couple things. When I first learned this model and learned that a large part of the sort of neuroplastic symptoms or mind body symptoms, whatever you want to call it, can be, like you said, repressed emotions. That made no sense to me when I first learned about this. I was like, what? And I was like, I'm just going to put that over here in the back burner and I'm just going to focus on these other parts for right now. I mean, but I now am 180 degrees. And actually, this is a lot of the work that I do with patients is actually teaching them how to bring up, feel our emotions and express them. So, a couple of key points. So, emotions, we evolved to have emotions just like everything else to protect us. And our emotional center is located in the unconscious part of the brain. It's not actually a part of the higher thinking, functioning, rational part of the brain. And it's the emotional center is kind of intertwined and close to the danger center. And, it's all kind of different structures in our brain, but, it's very related, the emotional center and the danger center. But it's part of our unconscious brain. Emotions come up automatically in our unconscious brain. We do not rationally decide to create an emotion, it just comes up automatically. And again, they all evolve to protect us. We get safety through being with other people, our tribe. That's what keeps us safe. We don't have sharp teeth and poison and sharp claws to protect ourselves. We have to have other people around us to live. And so emotions connect us to those other people. Love, if we lose someone, we have sadness. That's what connects us to other people to motivate us to want to be together and help each other because it can be hard, or if someone's in trouble, it takes energy and work to go save them, but love is what motivates it. Sadness, guilt, shame. So it stops us from wanting to hurt that other person, keep them in our tribe. Anger also is protective, and anger is the emotion that generates in us standing up for ourselves, fighting, protecting ourselves. So all emotions are healthy, normal, and evolved to protect us. But many emotions culturally are not accepted necessarily, or we're taught that they're not okay. And so, anger in particular is one of the emotions that we often learn is not acceptable. And if we all need social connection over here, and then there's our self agency over here. And when we're not treated the way that we deserve, that jeopardizes our self-agency, and that's when anger comes into play so that we stand up for ourselves and protect ourselves. But if our social connection is our parent, for instance, that's our lifeline to survival as a small child. If our parent treats us in a way that we don't deserve, then it is not an option to feel anger towards our parent. It's just not an option as a small child. So we let go of our self-agency so that we don't break the social connection, which is our lifeline from our primitive brain's perspective, so we don't die, is what our primitive brain is believing. So the emotion, when it's created, it either needs to be felt in our conscious awareness, which then releases it, or it gets pushed down under the surface into our subconscious. And so these emotions get repressed, and then they come out as depression or anxiety or symptoms or guilt and shame. And a lot of times people develop guilt and shame as a young child because actually they're not treated well. But expressing the anger is not an option. So the unconscious brain learns then that feeling and expressing the emotions is dangerous because it could jeopardize that social connection and we could die. So that's what the unconscious brain is responding to. And once the unconscious brain learns some survival information, it doesn't want to let go of that because it believes that we will die if we do that. Again, believe is, the unconscious primitive brain. It's really responding to these things. So these emotions, our brain views as dangerous if we allow them to come to our conscious awareness. So again, the danger signal gets dialed up to hold these emotions down where it believes it's keeping us safe. And when the danger system is dialed up for whatever reason, it then sends the warning signals into our body, takes us over into that fight, flight, or freeze mode. So instead, bringing the emotions up to our conscious awareness, which is then showing our brain that just feeling and expressing our emotions is not dangerous. We don't have to express anger to someone else. We can just feel the emotion by ourselves in the privacy of our own home, feel and express that emotion, resolve it just like you felt your sadness. You expressed your sadness. Nothing else changed in your life. You didn't get that dear person back in your life, but you felt the emotion, which is then what releases it so that the danger part of your brain can dial down. So that's how the emotions are involved. And then I just want to speak one other piece of information that I think was so key for me understanding all of this is that when the danger part of our brain is dialed up for whatever reason, our emotions or thoughts, worries, it sends a warning signal that can be ridiculously specific, like that pain down here, right in the right part of your lower abdomen, really intense. And understanding that that is a neural pathway in your brain, for whatever reason, decided to send a warning signal in that particular way. It could have decided to make a migraine or ringing in the ears or anxiety or pain in your knee or whatever it is. It decided to send it that way. But I think that's the other thing, is really understanding that the brain makes these warning signals in very, very specific ways. My brain likes sending it to my right knee because I had surgery on that knee a couple of times decades ago. So that neural pathway had been created. So that's pretty easy for my brain to just reenact that neural pathway.
That's really interesting. That's really interesting, and it's so, yeah. It's I think to many people it is really something new to understand this connection. But I can tell people who are watching and listening now, please make yourself familiar with this mind-body connection, with this between emotions and your symptoms. It is so important. And yeah, I have experienced this on my own, that I had to suppress my anger as a child and to be accepted, and then I learned this to suppress my anger my whole life. So I was also always a very kind person, good girl, good woman,
Yeah.
and
Yeah.
people
Good.
pleaser. But
Yeah.
under all this, there was a lot of going on in my body and
Yeah.
my
Yeah.
brain. So, and this
Yeah.
is really, and this could create a lot of symptoms. So now I know, for example, what you said with your knee, or what I had with my belly. Then usually when I get a stabbing pain here in my head, then I know, okay, I think I'm angry. So let's go into it. What could be
Yeah.
the reason why I'm maybe angry? And then I can express a bit of my anger, and then poof,
Yeah.
it's gone.
Yeah. Yeah.
That is really important to know. And that and
Yeah.
what you also say, that emotions, it's the uncomfortable emotions like anger, sadness, anxiety, or shame, that it is nothing dangerous, but actually it is something normal, and it has something to do with our society and acceptance. And
Mhm.
because we want to belong to
Mhm.
the tribe that's
Yeah.
evolutionary,
Yeah.
and to learn about your emotions and to learn how to express them in a safe way, I think
Yeah.
something very important. So that would be
Yeah.
a great point to now turn to another question. I'm sure that people are now really curious. What can they do to get better or to recover? Though, what is
Yeah.
your approach? Well, your approach,
Yeah.
and what do you think is most important for people?
Yeah. Yeah, for sure. And so one other thought about the emotion part is just like we're talking about, it's this unexpressed emotions, but it's also key that that anger is not in the conscious awareness. Like we are not aware of it. So I was the same way. I was highly sensitive kid. I was the good girl. I was, always trying to not make waves and people please, make other people feel good. I mean, I don't look back on that thinking, "Oh, I was angry and just trying to keep it down." No, I was not aware of that at all. But yet it was under the surface. So many times I talk with people and they're like, "No, I'm not an angry person." Like, no, it's not about in the conscious awareness. It's not being an angry person. It's really understanding that these are just normal emotions, and our brain stops us from feeling them and has protective mechanisms. And one of those protective mechanisms can be going to tears, which is something I spent my whole life doing, is that brain goes to tears instead of actually bringing up the appropriate emotion of anger because tears is safer. Being weak and a victim and sad, that's a safe place to be as a child instead of standing up strong and, you know, um, putting out the anger. So, my brain brought that all the way until years ago until I learned this and how to really feel and express my emotions and understand that protective mechanism of the tears. But also, it can be other things going to laughter, or going to intellectualization, or also going to different, like sometimes deep sadness and hurt and grief can actually be covered up by anger. Actually, that happens more for men in general. But so it's also kind of understanding really about the emotions. Um, but so kind of getting back to the piece of how do you get better? So kind of none of this is intuitive because what is intuitive is understanding damage in the body and we need to attend to the body. So, really thinking about that, it is the danger in the unconscious brain that's dialed up and stuck in place. So, fear in the unconscious brain. Again, it's not necessarily fear in the conscious brain, it's what the unconscious brain is responding to. So, we need to dial down that fear and that danger. That's what we need to do. We need to bring safety to the brain, the primitive brain. And there's lots and lots of different ways to do that, and it's going to be different for everybody. Generally speaking, there's, different categories that can be helpful for a lot of people. Number one is, well, I kind of look at it as three steps. Number one is understand the science, that this is the new neuroscience. This is about the brain signaling, not the body. That is not easy to wrap your brain around. In terms of something like long COVID or CFS, again, there are physiologic changes in the body. So there's lots of studies that show things like cytokine changes, mitochondrial changes, micro blood clots, cortisol, serotonin, inflammation. All of those biochemical changes are things that can happen when our nervous system is hypervigilant, stuck in fight, flight, or freeze. And we've known that for years, even. So now they're seeing this with the studies with CFS or long COVID, but just looking at that little detail instead of really standing back and seeing the whole picture. So again, yes, there's these scientific studies that show these things, but it really, from my perspective, fits with the whole scene. So understanding the science. The other part of understanding the science and why this is brain signaling rather than damage in the body is that many people, I mean, thousands of people have gotten better through this mind body neuroplastic condition model. Is by understanding this, thousands of people have restored their health. And there have been scientific studies. There was the pilot study on long COVID at Harvard that showed 2/3 of the patients after a couple of months had, I think 6 or 8 somatic symptoms largely improved, 40 to 80% improvement just after a few months of doing this approach. So it's understanding the science. And the second step is accepting the diagnosis for yourself, understanding why for you, what's going on in your body is the brain signaling and the nervous system. Um, because if we're still thinking that there's some sort of damage in the body and we're attending to the body, it's really hard to convince the primitive brain that we're safe and there isn't something external that needs to be done. So, accepting the diagnosis for yourself and then the tools. And I say it like that because if sometimes people just dive right into the tools, but they don't understand the science, and not that you have to understand the pieces of it specific, but understanding why this could help, and then understanding again, accepting the diagnosis for yourself, you really need to do those first steps in order to bring your brain safety because it's not easy to convince the primitive brain that you're really safe. We've evolved to connect up physical symptoms with damage in the body. So starting there. So then the tools, people are on the edges of their seats, I'm sure. So the tools, I kind of how I work with people is splitting it into different categories. And one of those categories are a lot of those kind of stress management tools that many people know about meditation, breathing, social connection, certainly getting enough sleep, music, being in nature, all those sort of stress management tools. Those are important, but what's actually more important is understanding how much of a role they can play. And while being important, they're not all of it. And just those tools by themselves, for most people, won't get you there. And the reason I say that is because often those are the only tools people know about. So they're doing all of these things, they're not getting better, they're getting increasingly frustrated, and which is then worsening the problem. And also then they then think that, well, I'm never going to get better because I'm doing all these things and I'm not getting better. And or this is the wrong path. There's still something wrong in my body that the doctors just haven't found, which is then making it worse. So, yeah, meditate if you like meditating. If you don't like meditating, that's okay. You don't have to meditate. But find whatever there is of tools to calm your nervous system. Laughter, finding joy is really important, and it's really hard to do that when you are overwhelmed with debilitating symptoms. But however little tiny pieces you can start putting in is important. But then the other pieces of understanding, like we talked about the personality traits and why the personality traits formed, what we went through in our life. Was it a parent that was broken themselves and really treating us badly? Or was it we had love and kindness and safety, but just an overly critical parent that then taught our brain we had to achieve to get their love and we need our love in order to have them take care of us so we don't die? So understanding the personality traits and that not all of the personality trait is bad, it's understanding how our brain takes it to the extreme, and we need to recognize that and see where that's showing up for us in our life regularly, be mindful of that and learn to teach our brain to loosen up on those things. And then the emotions and what our repressed emotions are, and really learning to bring our emotions up, feel and express them. And that's not necessarily easy when our brain has spent, 40, 50 years suppressing them. But really, emotional awareness and expression therapy is one kind of piece that can be really helpful. Expressive writing is a really helpful tool for many, and what this is different than journaling, which, can help in different ways, but expressive writing is stream of consciousness writing, and then you get rid of it. And that's to get up those thoughts and worries and emotions and bring them to our conscious awareness, which can help release them. Our thoughts turn the danger system up in our unconscious brain, and we can't just get rid of thoughts by thinking. And so expressive writing is a way to kind of bring them to a different part of our brain, filter them through the rational thinking part of our brain that helps to release them. So, and the other piece is kind of the pain reprocessing therapy or neural reprocessing therapy, which is where we're kind of leaning into the discomfort and coupling it with safe signals, sort of like exposure therapy, and as a process to teach those neural pathways to create new neural pathways, just like typing on the keyboard with the P on the left is using our body in a way that that shows our brain that we're not in danger. So turning on the symptoms a little bit, not too much, but a little bit, and then coupling it with safe signals, smiling, listening to music, telling ourselves we're okay, being with a friend, whatever it is, but doing that as a process little by little. And it's going to change every day how much our body can participate in, but kind of putting in all of those pieces. And really at the root of it is understanding that we need to bring safety to our brain, dial down the fear. But the thing is that we actually need to face our fears in order to show our unconscious brain that we don't actually need to be afraid of these things. So it might be experiencing painful thoughts and painful memories and painful emotions, but really showing our brain that that's not physical danger, that we actually are strong enough to handle that, and making the movement with our body, or if it's something like POTS, standing up and standing up in a safe way, sitting down, standing up, sitting down, and doing that in um, in a process, in a way over time that sort of desensitizes the brain and shows our brain that we don't actually need to fear the movement or the emotion or the difficult conversation that we're avoiding, or all of these different pieces in our life.
Yeah, wow. Yeah, thank you. Thank you really very much for describing so many useful things that people can do. And yeah, again, my mind is racing because I think about my own journey and all the things I tried and that didn't help, and to learn what really is helpful. And I'm also still on a journey because, yeah, I have to face a lot of fears. And for me, it all has to do with social situations. There's a lot of social anxiety, and but because I want to change things and I want to have another life and I want to do things that have to do with other people, so I have to face a lot of fears. But I now know how this all works. So actually, um, the most important things are maybe to know for people is really um, um, gaining a lot of knowledge to understand what this actually is, and that this approach makes sense to you, and that this is also not an alternative approach but a really scientific approach. It's very
Yeah.
neuroscience, and
Hmm.
it really depends on where you look at the science and where you put your focus on. It's just, as you said, do you go into the details into the cell or into the mitochondrion, or do you see the whole organism and how everything is connected with everything? So understanding and knowledge, very important, and then actually to teach your brain that these things that it perceives now as dangerous are actually safe. So it's a lot about finding safety, and of course there are many different ways to do that, and for some people meditation is very helpful, for others not. For me, for example, meditation was not helpful because my brain was so overactive that, and my brain has learned that stillness is dangerous because in the next second something will happen again. So it's better to stay on that alert state. So it was a lot about, you have to find ways to calm your brain down and to send enough safety signals. So thank you very much for covering so many important and very interesting things. Because we are already talking a while, I just want to ask you, I know you're really passionate about this mind-body approach, and I think people feel your compassion and your excitement to share this knowledge and to bring it on other people. So if you would like just to share what you are planning, I know you're connecting with people worldwide and you're engaged in special organizations like the PPDA. If you would like, you can share what you're going to do.
Yeah, absolutely. Oh, thanks for that. I am very passionate about this. And, as a family medicine physician, it just, just deep in my soul and a heart, it just makes me so sad and keeps me up awake at night, just knowing that so many people are suffering and that there is a way out. So I'm on the board of the PPDA Association, the Psychophysiologic Disorders Association, which is a nonprofit, and we are really working hard to try and spread this knowledge and this information. And we have a community that you can be a member of and really work to get the word out. We are actually having an in-person conference in Boulder in September for anyone. There will actually be some people from the UK and around the country. All the leaders in this world will be there, and we're going to be talking even about how we can really make better change and get this information into the mainstream. Just like you're saying, this is not alternative medicine. This is the new science. It's just a different way of thinking about it that we didn't know before. So I'm involved in that, and my own clinic, Resilience Healthcare. I have virtual classes with people around the world to try and teach, the more specifics about how to get better. And I do work with people one-on-one as well. But, there's just lots of places to get the information as well. Lots of different coaches around and kind of books and podcasts um, so really kind of connecting up where you can to get the help and support. And the PPDA is a good source for that has a lot of resources really around the world of how people can connect up.
Yeah, I will put the relevant links you mentioned from the Harvard study to the PPDA, and of course also to your clinic in the summary I have on my website. So maybe you have one final message for people listening and watching, and also how people can find you.
Yeah. I think the final message is really is that to be open to these ideas. You don't have to really kind of understand 100% or, maybe some of it doesn't make full sense yet because it is a paradigm shift in thinking. It is not intuitive, but really just being open to the ideas. And as you explore more and learn more about it, it's really about finding evidence for you, for your brain, um, of how to get better, and that there is a way out. And a lot of people don't think that they'll be able to get better. I mean, I'd say probably the majority of people think that it wouldn't work for them, and they do get better. So just understanding that, and I do like people really reaching out to me in whatever capacity, even just letting me know that they got better. And my website is resilience-healthcare.com. I am trying to figure out a way through the PPDA and just how we can come together to get this information out to the world. And it's going to be physicians and clinicians, therapists doing the work, but it's also going to be the people who have gotten better telling their stories and all coming together. I think that's how we can make a profound difference and help more people.
That sounds great. So thank you very much for these final words. I hope it will encourage people to think differently about things like ME, CFS, and long COVID. So thank you very much for your time, Becca.
Yeah, you're welcome. It was my pleasure.